Diabetes. What is it? When you eat, your body turns food into sugars or glucose. At that point, your pancreas is supposed to release insulin. Insulin serves as a key to open your cells to allow glucose to enter and allow you to use the glucose for energy. This system does not work with diabetes. Type 1 diabetes is the more severe form. It is also called insulin-dependent diabetes or juvenile diabetes because it usually develops in children and teenagers. With type 1, the body's immune system attacks part of its own pancreas. The immune system mistakenly sees the insulin-producing cells in the pancreas as foreign and destroys them. These cells are the ones that send glucose in the blood and produce the necessary amount of insulin to normalize blood sugars. Without insulin, the sugar stays, builds up in the blood, and results in the body's cells starving from the lack of glucose. If left untreated, the high level of blood sugar can damage eyes, kidneys, nerves, and the heart, and can also lead to coma and death. A person with type 1 treats the disease by taking insulin injections. The challenge with this treatment is that it's often not possible to know how much to take. The amount is based on many factors including food, exercise, stress, emotions, and general health. These factors fluctuate throughout the day. If you take too much, then your body burns too much glucose and your blood sugar can drop to dangerously low levels, which if untreated can be potentially life-threatening. If you take too little insulin, your body can be starved of the energy it needs and your blood sugar can rise to dangerously high levels, which can increase the chance of long-term complications. Type 2 diabetes is the most common form, also called non-insulin dependent or adult onset diabetes, since it typically develops after the age of 35. However, a growing number of younger people are now developing type 2 diabetes. People with type 2 are able to produce some of their own insulin, but often it's not enough. Sometimes the insulin will try to serve as the key to open the body's cells to allow the glucose to enter, but the key won't work. The cells won't open. Often, type 2 is tied to people who are overweight and live a sedentary lifestyle. Treatment focuses on diet and exercise. If blood sugar levels are still high, oral medications are used to help the body use its own insulin more effectively. The number of people with type 2 diabetes is increasing rapidly worldwide. In the U.S. alone, there are over 20 million people living with diabetes. There are an estimated 54 million people with prediabetes, a diagnosis given to those people who have glucose levels above normal, but not high enough to be diagnosed with diabetes. For many people, it's possible to prevent type 2 diabetes. The key to success is in actually preventing prediabetes and type 2 to begin with. Identifying risk means asking yourself the following questions. Am I age 45 or older? Am I overweight? Do I have high blood pressure or cholesterol? Do I have a family history of diabetes? Am I African American, Hispanic, American Indian, or Asian? Do I have a history of diabetes occurring during pregnancy? Did I deliver a baby weighing more than 9 pounds? If you answered yes to any of the above questions, then you should be screened, but also reduce your risk of prediabetes and type 2 by implementing the following. Look for opportunities to move more during the day. Exercise 30 minutes at least 5 times per week. Eat a healthy meal plan including grains, cereals, fresh fruit and vegetables, low-fat dairy and lean meat. Reduce fat intake. Reduce food portions. And maintain an ideal body weight, especially around your waist.